Hey everyone in YouTube land. I'm doing a really quick update before I go to bed. It's like 1:23 in the morning here in Indiana. Okay, well, yesterday, 2 days ago if you want to get technical since it's like 1 in the morning. Monday I had 2 appointments I went to. One was my regular routine OB visit, just measuring me and seeing if everything was okay. Well, it was then when I was at that appointment. Then we walked over to my non-stress test in the maternity center. And they hooked me up to a machine where it tracks Isabella's heart rate and my supposed to be non-existent contractions. And, well, guess what? I was having contractions and I didn't even know about it, which is not normal. Well, to me it wasn't because I'm only like 29 weeks. But they were pretty up there. My highest one was 45. So they made me drink a can of Sprite and a bottle of water. And they stopped for a little while, but like my doctor, he told the nurses to tell me to keep an eye on the contractions when I went home, drink a lot of fluid, and lay on my left side. But yeah, I did that when I got home, but I was still having them, and like towards 10 o'clock they were getting worse, like more intense and closer together. And kind of felt like they were gonna rip my ribs apart, or like Bella was trying to push herself out of my stomach or something. I don't know, it's kind of hard to describe and it's pretty weird. So I started messaging my friend Katie and Adam's stepmom Trish, who always takes me to the appointments. And she had said to call her if I call the hospital and they say for me to come back in. I forgot where I was. I was originally an airhead before I ever got pregnant, so it really got worse. Something about, yeah, the hospital. I called them, and they told me the only way that they would be able to figure out what's going on besides the obvious I was having contractions was if I came back in and they checked my cervix. And we left my house around like 12:40, and I was having contractions every about 3 to 4 minutes, and they didn't go away when I was like standing up or walking around or anything like that, which they're supposed to do if they're like Braxton Hicks contractions, but obviously they weren't. So when I got there, they hooked me up back to the machine, and I was still having high contractions, so they did a fetal fibronectin, I think they called it. It was a test where they swab inside to see if you're in preterm labor or not, and that came back negative. And she also had me do a urine test because she thought I was having a bladder infection. That also came back negative. And she also checked my cervix, and I wasn't dilating, thank God. But I was still having contractions, so they gave me this shot in my thigh that makes you stop having preterm contractions, and it's called terbutaline, I think. But it made me really shaky, and it made me feel like I was on some kind of drug that makes your heart beat really, really fast. It was really scary, but I was trying not to freak out because I had 2 other people in the room, and I didn't want them to get freaked out if I started freaking out because of it. But that worked. It stopped the contractions. And So I left to go to the hospital at around almost 1 in the morning. Didn't leave the hospital until about almost 5 in the morning. So I was really tired, and I'm still tired, but tired and sleep deprived and cranky. But I haven't had any contractions since then. And I'm pretty sure hopefully that won't ever happen again, because seeing as Adam's not here, so I would have freaked out if I went into preterm birth and he wasn't here, because that's pretty scary thought, having a premature baby, especially since she's going to be 11 weeks premature if she was born right now. But Bella and me are fine, and hopefully she won't be coming out for another 11 weeks. And kind of learned my lesson. I was really in a rush for her to be here and didn't really care if she came early, but yeah. After that, I don't care how long she takes. She could be like 4, 5, 6 weeks late, and I'll be happy just as long as she's fine and not premature. But yeah, I'll have another update for you after the second, because I have to go to another ultrasound, and then I'll put another update for you guys can all see her pictures. But it's 1:30 in the morning, so good night or good morning to all you people viewing this in YouTube land. Message, rate, comment, subscribe, all that good junk. Or don't really care. I don't really get on this much besides to do videos when I'm really bored. But yeah, thanks for watching. Bye bye.